Our next speaker is Chris Compton from Novartis, from U-BIOPRED, who U-BIOPRED was not only mentioned by the patient organization as being top on involving patients, they also were kind enough to swap around this afternoon with another speaker. So, Chris, if you...
Yes, it's very much my privilege to be able to give this presentation to you today. As Thierry mentioned, we across the project, particularly in the respiratory area, we've been sort of trying to pursue a sort of tag team approach between the project coordinator, the academic project coordinator, and the FPA leads across the different projects. And Professor Peter Sturck from Amsterdam has been pivotal in getting this project up and running from the initial expression of interest stage through to where we are now. And undoubtedly would have been giving this presentation today if he hadn't already had a holiday scheduled. But in the true spirit of collaboration, I've been involved with this project and also proactive from their inception when we wrote the original calls. So I'm very pleased to have the honour to give the presentation. And Scott Wages is down here from the consortium as well. He's been absolutely pivotal again in getting us to the stage that we're at presently in providing first-class project management support for us, and more than that, technical contribution as well, scientific technical contributions. So U-BIOPRED stands for Unbiased Biomarkers for the Prediction of Respiratory Disease Outcomes. And that's quite a lofty title, but it's really about looking at disease in an innovative and different way. And that's what I hope will come across when I run through these slides with you. So this slide gives the problem statement for severe asthma. So asthma is a condition that affects over 300 million people globally. About 40 million of those are resident in the EU. And thanks to advances in pharmacotherapy and other aspects of patient management, patients are able to, in a large number of cases, be well controlled with present treatment options. But there are still a substantial percentage of patients, at least 10% of patients, who do not have their disease adequately controlled. And the definition really of severe asthma really relates to those that we presently do not have treatment options for. Despite best use of available therapies, they still have uncontrolled disease, and we need new ways of understanding these patients and to be able to better treat them. It's estimated that 10% of patients with asthma, including those with severe disease, account for 50% of the costs of total asthma costs for patient care. So this is really a major public health issue, and that's why this was one of the calls that was selected to be the first amongst those for respiratory disease. We really felt that here was a clear unmet need and a research topic that there was a real commitment and critical mass between the different FPA companies to take on. And exacerbations of the disease, they're a terrifying experience for patients. Imagine that you're fighting for breath, administered to hospital. Over 12,000 Europeans a year still die from asthma in an exacerbation setting. So that's the public health statement, and that's why we decided that we needed to progress a call in understanding the disease, because it's clear that severe asthma is a syndrome. It's not a single disease, but there are different subtypes, or so-called subphenotypes within the disease. And it's critical that if we are going to better manage patients in the future and identify new therapies, that we actually need to understand those different subtypes and the different mechanisms that are in play, disease mechanisms that are in play in those different subtypes of the disease. So that's really the key aim of this project. It's to help us better understand severe asthma, to improve patient care. So by better understanding the disease, then we'll be better able to understand different individual patient characteristics, better tailor the management and therapy of patients, and importantly, we'll be better able to actually identify different treatment targets, potential targets that could be of use to advance new medicines. And the key bottlenecks to getting new therapies to patients, to meeting these clear unmet needs, really centre very much around understanding the disease, enabling the production of biomarkers that would be relevant to different subtypes within the disease, different subphenotypes, so that we can better, first of all, identify particular patients with particular characteristics, but also better able to follow them up and understand the effects of intervention with therapies, and also to help us to develop new therapies as well. In addition, without understanding the disease, then we're at a loss when it comes to having relevant preclinical models, so that's animal models or models using human tissue, for instance, that are actually relevant to severe asthma. We've got to understand the disease first before we can actually really get those relevant preclinical models and also clinical models that will help us to progress new medicines through into patients and hopefully progress those that have got a much higher chance of actually working and being benefit to patients. If we look at the different bottlenecks through from the pathobiology of the disease through to different phenotypes, subtypes of the disease, clinical outcomes, the things that we can measure that the patients might complain of, and ultimately to progression of the disease, then it's clear that we have particular bottlenecks related to predictive biomarkers to identify the different patient subtypes, different preclinical and clinical models that, again, we could use to predict potential effects of a new agent, for instance, in man, and in particular, targets that may be amenable to therapeutic intervention and help enable us to actually get new, better tailored medicines to patients with severe asthma.